Hi, my name's Terry Fenwick. I'm an orthopedic surgeon here in Vincennes. I practice orthopedics and sports medicine. This is Good Samaritan Spotlight with your questions answered. One of the common questions is, when should you see an orthopedic surgeon for knee pain? Pretty much if your knee is just sore for a day or so from too much activity, you can probably just take a little bit of rest and ice and you may get better. But if it doesn't, I highly recommend you see your family doctor or call us directly and we'd be happy to see you. The things we typically do are evaluate the structure of the knee, what the knee feels like systematically, if there's any swelling or tenderness, and then make appropriate recommendations. What are the most common causes of shoulder pain? Typically, shoulder pain, it might just be a simple problem like overuse, a tendonitis, maybe a bursitis. Many of those things resolve over time, but if it doesn't, we're happy to see you and do a formal evaluation. Worst case scenario is severe arthritis or maybe a rotator cuff tear, but those things are fixable as well, so we can get you back on the road and doing things. Can joint pain be treated without surgery? Absolutely. Most joint pains are treated without surgery. Many people are afraid to come to see an orthopedic surgeon because we have the word surgeon in our name. But in fact, most of the people we take care of don't need surgery. They may need advice, they need recommendations about what to do. They might need a medication or an injection or therapy, but many of the people absolutely do not need surgery, so don't be afraid just because we're surgeons. We're happy to see you. What does an orthopedic surgeon treat? Well, for the most part, we treat things that are muscle or joint or bone related. That can be anywhere from the feet up to the shoulders, even cervical spine. We many times will evaluate and make proper recommendations. How are sports injuries treated by an orthopedic specialist? Of course, with every sports injury, the thing we want to know is what happened. Give us the details of the injury to the best of your knowledge. We sort of reconstruct those in our mind because the certain forces applied at certain angles create certain injuries. So we're happy to see you, make an evaluation. Of course, following the story, we want to do a physical exam. Sometimes we need x-rays, sometimes we don't. Sometimes if it's severe enough or puzzling enough, we might get an MRI scan. What is the best treatment of hip, knee, and shoulder pain? Well, certainly the first form of treatment is to think about, why are you having this pain? If it's something just from overuse, cut back a few days, take some rest, maybe apply some ice or heat, whatever you like the best, and see if it resolves. If it doesn't, then once again, we're back to the very basics of a thorough evaluation with a history and a physical exam, usually radiographs or x-rays. Then we're going to make recommendations such as physical therapy, ice, sometimes injections, on an occasion, if you need it, surgery. How does physical therapy help after an orthopedic injury? I've told therapists for many years they've done an incredible job at getting patients well. We tend to make the diagnosis. Many times we'll put it in the hands of the physical therapist. Then with the efforts of the therapist and the patient themselves, they'll just resolve their issue totally. So physical therapy is very important. Not all physical therapy is hands-on, going to a physical therapy facility, but usually that's where it starts. A lot of the physical therapy recommendations can be done and followed up at home on your own if you're compliant to do so. What should you expect during recovery after orthopedic surgery? Surgery is very well controlled, very well considered, and very well performed by all the orthopedic surgeons here in town. What you can expect after surgery is close, careful attention to whatever pain you're having, whether or not there's any signs of infection, and particularly guidance of physical therapy and follow-up. Every orthopedic injury and surgery has a certain time frame of recovery, and we try to make sure you understand what those time frames are. Sometimes it feels like it's not going fast enough, but we don't really control how body heals or how quickly it heals, but certainly you're a good participant, and your participation in therapy makes a big difference. When can you safely return to sports after an injury? That's very much injury dependent. Some injuries, within a day or two or same day. More severe injuries, it could be weeks or months if necessary, particularly if it's a larger injury like an ACL. So that has a very broad answer. How can you improve strength, mobility, and movement after an injury? That's a great question and something that really doesn't get fully addressed. Sometimes the patient or the athlete's just so interested in getting back on the field, they forget that they have to be able to perform at their best in order to do so. That's where physical therapy and you doing your home program and close follow-up and ultimately an evaluation by your therapist or physician about return to play. We have very strict criteria that we like to utilize in order to make sure that you return to your sport safely.